August meeting for the statewide CDSMP collaborative for the state of Colorado, and we are going to start our August meeting, and this meeting is being recorded. So I'm going to start with our first slide somewhere. Okay, or not. There we go. All right, so here is our agenda for today. I will start with some introductions. We'll have Kelly share on state with data entry, including her survey. Connie will go over the current grant year that we are in. There is an update from Telegen again on the DSMP reimbursements, which I think Connie will be speaking on behalf of Meredith today. And then another update with HealthLinks, and we have Lila here as our guest. And again, some discussion on the name of the course that people are calling their CDSMP classes, and sort of get some final decision on that, I think. And then review our statewide training, any future agenda items. So with that, I'd like to just go down the list that I have showing and make sure we have people here that just kind of welcome you all. So I have Crystal Ryder, yes?
Yes.
Great, welcome Crystal. She is from Zacatecas down in Pueblo. Holly Darby.
Yes, and Whitney's with me.
Okay, great. Holly and Whitney. Good to hear you guys again. Maribel Olivas.
Yes.
And Maribel, remind everyone where you're from.
Clínica Tepeyac.
Okay, great. Thank you.
You're welcome.
Kelly McCracken.
Yep, I'm here. Thank you.
Kelly, are you with us?
Yes, I'm here. Can you hear me?
Yes, thank you. Okay.
Okay, no problem.
Be on my side. Connie Young.
Yes, I'm here.
We all know Connie is from the State Unit on Aging. And then we have Connie's guest with us today. Is it Lila?
Lily.
Lily, excuse me. Lily Tenney?
Yes, I'm here. Thank you.
Great, and she's with HealthLinks. Did I miss anybody?
Yes.
Melissa. Oh, Melissa, I'm sorry. Wow, you're not showing up on my...
I'm on my cell phone, so I don't know if that makes a difference.
Oh, that's probably why. Okay, thank you. I was going down the list on my go-to meeting enrollment here. So thank you. Melissa's here from Boulder County AAA. Anyone else? It sounds like we might have just added someone. Did someone new just come into the meeting? Did someone just join us? I'm not getting a name. All righty. Well, that's our roll call for now. If we miss somebody, please speak up if you hear somebody. So there's our introductions. And where is my clicker? There we go. So again, just welcome everyone. And as always, please check the selfmanagementcolorado.org, not only for classes, but this is also where you can access minutes to this meeting as well as a copy of this webinar. So we are going to start our agenda with Kelly McCracken.
Hi, everybody. I am reading some emails I got from folks, so thank you for those who responded to the questions that Mary Pat set out. I just wanted to ask for folks on the call that maybe didn't have time to take a look at that, or would just like to let me know here on the call what your thoughts are. We talked about this at the last call, but there were not many people in attendance on that call. So this is a question about whether or not folks would like a brief presentation from our epidemiologist, chronic disease epidemiologist here at the state in regards to chronic disease data and trends throughout Colorado. That people could use that information to kind of help think about where there may be gaps, where there could be CDSME programs that there currently aren't because of high prevalence of chronic disease. also to help people think through how they might want to apply for funding in the future and use these kind of data points to make the case for funding. And then also the second question is, if the question is yes, or the answer is yes, you want that presentation, the second question is, what population do you want to focus on in terms of age group? Renee has already done a presentation on the aging population, so adults 60 and older. She's definitely willing to adjust that if we're looking at a younger age group, but I wanted to get everybody's opinion on age, what you would like that presentation to focus on. So any thoughts about, is it a yes or a no in terms of wanting that type of presentation, and then what age?
Well, this is Mary Pat from COA, and I did not yet directly respond to the email this morning, but yes, we'd love the presentation. And number two, we would be interested in ages 18 and older, since the curriculum is applicable to those ages.
Okay.
Then that would just broaden our interest, but we'll be happy with whatever we can get.
Okay, thank you.
Hi, Kelly. This is Crystal from Secahec. And would that presentation, would it be an in-person or a webinar-based?
Yeah, that's a great question. I think it would probably be webinar-based, since these calls are all virtual. But if we were going to have an in-person meeting at some point, we could try to get Renee's schedule to fit that. I just don't know what the plan is for an in-person.
Okay. I think that we would be interested in such a presentation. Webinar works really well.
Okay, great.
And then I agree with Mary Pat, the 18 and older, but if it's already broken down into the 60 older population, it would be nice to see the difference between the 18 plus and the 60 plus, how the trends differ.
Yeah, that's a great idea, actually, and I don't think that should be a big issue, so I can request that of Renee. That's a great thought. Others?
Hi, Kelly. This is Melissa. And,
hi, Melissa.
And I would definitely be interested in, we serve older adults, but like Crystal was saying, I think it would be interesting to see, even if they could do it decade by decade. I don't know how the breakdown is, but that would be interesting, especially like the 50-year-olds and where they're headed.
Yeah, great. Thank you.
Hi, Kelly. This is Wells County, and I think we agree with the last couple as well, that if it is broken out, that would be great, and if not, then that's okay.
Great. Thank you.
And same for me. This is Connie. I think it would be interesting, too, to see any geographic differences, in terms of demand and that. I did look at a lot of your data, which is great, on your website about a lot of that when I was putting together our grant proposal. But it would be interesting to take a look at that and just kind of see if there's some areas that are really important or really high need that we haven't reached out to yet.
All right. That sounds good. Anybody else on the call? All right, awesome. I think I have my marching orders, so I will work with Renee on thinking through what this presentation would look like. I'll give her our upcoming dates for October and November and ask her to look at her schedule and figure out maybe which one works best. And then Mary Pat, I'll get with you as soon as I know that, so we can work her into the agenda.
Yeah, that sounds great. Are we still talking about a September agenda item?
Oh yeah, I guess we also have September as a
or did you want to push it back to October?
Yeah, she's still not back after the passing of her father. So let me just give her the next 3 months of dates and find out which one is best. I would like to do it before November, but I'll see if September or October work for her.
Okay, no problem.
And then I'll let you know.
That sounds good.
All right. Well, thanks everybody for entertaining that question, and we'll get that going. And my guess is this kind of conversation can lead to other things, and so it's great to start it. And if you get interested in something that she presents and want a deeper dive into that, then we can talk about that as well. So I think it's great that we're going to have this, so thank you. And then as far as data stuff, I don't have anything to report. Things are just sort of moving along as planned, but I wanted to open it up for any questions, comments, concerns that we could answer for you around data. All right, any other things for me at CDPHE that I can answer or help out with? All right, I'll turn it back over to you, Mary Pat.
You bet, thank you. You're doing such a good job. No one has any questions or concerns.
Yeah, well, thank you.
Yeah, all right. Thank you so much, Kelly. Then we'll move on to the next agenda item. I also wanted to mention, it looks like Ellen Pilstrom is on the call also. Ellen, are you out there?
Can you hear me?
Yeah, great.
Oh, good. Yes, I'm here.
Great.
Hello, everyone.
Chance to introduce you, so I wanted to be sure.
Thank
we
you.
acknowledge. All right, great. All right, so Connie, you're up on any final updates with the current grant we're finishing up. I still had sustainability maybe as a topic, or anything else, Connie?
Yeah, thanks, Mary Pat. I found out we needed to do an extension request for any action items that hadn't been completed this year, and I had to get that in last week. So I submitted that, and I've been given kind of an indirect encouragement, I guess you could say, that those are typically approved. It's certainly no guarantee, but I think we'll be okay with getting permission to finish up what we haven't already done this year. So we'll see, if we may have that decision by the September call, or, whenever I do have that, I'll let you know. And then we'll move forward on those items. I also, I was in touch with Lindsay Blackwelder about the possibility of funding some additional completers from classes this year, and in doing that extension request, I realized we went over budget on some things, so there's not as much flexibility as I had hoped. I did send an email to Lindsay yesterday telling her what we could do and asking her if she thinks it's worthwhile, because it's a relatively small number at this point, but there's always a possibility for wrapping or looking at some completers in the extension request for this coming period of time. On that extension request, I haven't done one of these before. Some people say it's fine to request a 12-month extension. I did do that primarily because we have the sustainability effort that we have, background information and research from the consultant, but we really don't have a plan per se that would say what we're going to do and set timelines and say, who would be responsible for what. And that's the only reason for doing the background research that the consultant did, which is to actually put something in place to help sustain the program long term. So I'm hoping to carve out a little bit of money to help with that, and I did ask for the extension for a 12-month period, primarily or really exclusively for that particular item. But again, we'll see what they say. And on that note, let's see, did somebody else just join? Sounded like someone else joined the call. Sorry?
Yeah, Glenda Mitchell was here.
Glenda.
Hi,
I heard Glenda. Yeah, who is that?
This is Monica.
Oh, okay, great. We have Glenda and Monica, and was there another person that just signed on right now? Was there someone that just signed on right now? Okay. So on the sustainability plan, we had hoped to have it finalized last month, but it will be this month by the end of the grant period. And again, as I was looking at that, we were talking about it being a plan, but as I just referenced, it's really more a report with background information and recommendations. So what I would like to do, and I talked with Mary Pat about, sometime over the next couple of months, once we hear if we will have, if we're going to get any additional grant funding, we could, what I'd like to do is get an in-person meeting together again. I will have some additional travel money for people from outlying areas as we have in the past, and have a come together kind of meeting where we talk about where do we go from here, and that would be applicable whether we get grant funding or not. But and then the other part of that I talked with Mary Pat about, which I'm excited about, is to have a presentation from COA, and we'll see if anybody else makes sense to be on that, to talk about how they have successfully worked with different health plans and other organizations to fund the CDSMP, excuse me, so that, because in the sustainability effort, whether we have any additional grant money for a couple of years or not, the long-term plan is to find other sources of funding beyond the grant, because grants, as we all know, don't last forever, and they're not the wave of the future, so we do want to catch the wave that that will propel us into the future, which is reimbursements and contracts and that kind of thing. But anyway, I think that would be a great opportunity for COA to kind of showcase what they've done and share their successful approaches, and let everyone else know, give some guidelines for how you all might do that in your areas. So that's the plan for that. And kind of, related to the year or additional grant funding request, I have not heard anything about that. Their plan was to announce by September 1st, which isn't that far away. I haven't gotten any questions, so I'm less optimistic about it. It was, but I haven't heard, and I do know that sometimes, at least one person around here who applied for an ACL grant, they get behind just like we do, and they didn't get even questions about their proposal until after the date that it was supposed to have been announced. So, there's still a possibility, but it is, as I mentioned before, it's very competitive this year. They're only funding 10, and in up to now they've had 22 grants. Does somebody have their phone on speaker? There's a lot of background pushing. If you do have it on speaker or something, if you could maybe take it off, that might be helpful for everybody to hear.
Yeah, I hear it too. There we go. Maybe they had to hang up.
Oh, well, hopefully not. But
okay, I don't know what, okay.
Sorry if they, hope that didn't happen, but in any case, so as I said, I'm less optimistic, but we haven't heard one way or the other, so there's still possibility. But as I said, it was competitive, and they opened it up, as I think I mentioned before, to not only state agencies, but other nonprofits. So, the pool of applicants is broader, and the pool of opportunities is smaller. So we'll see. Hopefully, we'll know something by the next call. I think that's everything on those items that I have. Does anybody have any questions? Okay, thank you.
All right. So our next item on the agenda was the update with Telegen and their diabetes self-management reimbursement opportunities. So I'll let Connie share on behalf of Meredith.
Yeah, Meredith was sorry that she couldn't be on the call today, but she did send out we did send out her PowerPoint presentation and a link to a survey that is at the end where she would like to get input from all of you. This is a really exciting opportunity that has been evolving for a while. Emeritus has been so great about being committed to this and working really hard to get some things in place to offer more diabetes self-management classes. And as you may remember, she works with Telegen, which is the Medicare quality improvement organization in Colorado, and they are interested exclusively in the DSMP, not the broader chronic disease self-management program. But the really exciting part is that it's not a guarantee yet, but she's on track and feels confident that or at least fairly confident that she'll be able to secure CMS reimbursement for DSMP. I didn't ask her if that's long-term or on a project or pilot project basis, but hopefully we can get that information once she confirms that. But she's looking at a reimbursement of $140 per completer, but they would also buy the books and CDs, so it'd be pretty similar to what you're getting through the grant now. But so I'd really encourage you to look through that PowerPoint and then to respond to the survey that she included. We tried to get that out earlier and it somehow didn't happen, so she extended the deadline to next Friday, the 14th. So if everybody can respond to that, everybody who does any or is interested in doing any diabetes self-management program classes, that would be great. But again, this is, we're trying to move towards sustainability, as we just talked about, and this is one great opportunity to do some of that with DSMP. As she's mentioned before, it's in, they have priority areas, so it's not everybody across Colorado, but in their high priority areas and populations. So, but anyway, I'm excited about that. Does anybody have any questions or comments about that?
Hi, Connie. This is Susana from Clínica Tepeyac.
Hi, Susanna.
Hi. I have a question regarding to this project. If we are like we used to have our license directly with Stanford, and now we may going to sign an MOU with COA. So, do you think that we can participate in this in the Telegen project, like we directly, Clínica, or through COA?
I don't know the answer to that, but I would guess there's a way to deal with to have you participate one way or the other. I don't know that it would be a disadvantage to you either way or an advantage, but because you're working with COA, I would guess it would be through COA's involvement, but I guess I can let Mary Pat speak to that a bit, but I think COA, if you're working with them, they're going to be very supportive of your involvement. So I don't know the answer to that, but I think there's a way. Mary Pat, do you have any thoughts on that?
Actually, we've already had some discussions directly with Meredith on that.
Oh, okay, great.
Not just, I do believe, as you're saying, Connie, that it needs to be through license holders. That's my assumption.
Yeah.
More directly, because then that too is licensed to do the classes. So as far as Clínica Tepeyac, Susanna, that's something we've already mentioned to Telegen, to Meredith, about your interest in doing reaching into the Latino population with the diabetes curriculum. And so Kelly has also been on top of that, and we're talking about expanding the need for more leaders into that area and some possible funding opportunities there, as well as getting our two master trainers, Kelly and Clara, cross-trained in diabetes so that we can train more leaders in the Latino version of the diabetes. So it's definitely on our radar, and you guys would be part of all of that, receiving the benefits of that and expanding classes and the reimbursement opportunity.
Awesome. And so should we answer the survey?
Yes. Sure, you can still answer the survey, absolutely.
Okay. Okay.
And then I know we've got a meeting scheduled coming up, so we'll talk more about that one-on-one.
Okay, great. Thank you.
Oh, and that reminds me, Meredith did say in her email that she would like just one person per license holder to respond, but I would go ahead and respond to that, Susanna, but just have one person from Clinica do that, because she's trying to, probably be fair in terms of numbers, and if 5 people from one organization respond, it kind of skews would distort the results a bit. So I would say one person per organization.
Okay, clear, yes.
Okay, great. Good question. And Meredith also did say that since she wasn't able to be on the call today, that everyone and anyone is more than welcome to email her with additional questions. But was there someone else that wanted to chime in? Okay, thank you.
Great. All right, thank you. That's a great opportunity. Again, we spoke a little bit about that at our last meeting, but this is a great opportunity for all of us to take advantage of. And I know Meredith's working very hard to reach into several different license holders around the state representing those areas. So good news, good news.
Yeah.
All right.
And actually, I'm sorry, since that issue came up of more organizations signing MOUs with COA, I do believe that I believe that Meredith would want each organization to one person from each organization, even if you're working under COA's license. But since she did say I'm sort of retracting what I just said. Let me check with her to see if she would like each organization, even if you're going to work under COA's license, if she would like each organization to respond. I'm guessing yes, but let me double check on that, and I'll try to get a response back, or try to respond to you all by tomorrow if I hear from her. Does that make sense? No?
Yes.
Okay, so.
Yeah, and I think Meredith's abreast of what's some of the transitions, so it's fine. I mean, we've had those conversations, and we welcome that input.
Oh, you do? Okay, so you already know, even though she said only one person per license holder, so you're sure that she wants input from each organization, even if they're operating under your license?
Yeah, I think she welcomes the input. It's just, I think, multiple, like not myself and then Lindsay and, multiple people from the same target area. I think she's aware, and I think she can decipher through that information as needed. We welcome that information.
Yeah, I'm not sure if it's anonymous. She may not be able to figure out who's who, but
okay.
I'll just confirm that with her. Yeah, I think you're right, and she may not have really thought about the fact that COA would be the license holder for a number of different organizations. I'll just double check that.
Okay.
I agree that it would be helpful to get everybody's input, Mary Pat. I just want to do whatever she wants to do. So.
And we're just in some transition time right now, so it's sort of understandable to get some different input. So.
Sure, that makes sense.
All right. Let's move on then to house links, and Connie and your guest.
Thank you. Yes, Lily and I talked yesterday, and I think most of you, if not all of you, probably have heard about what this is about. But Lily can fill in the gaps a little bit in my explanation. But basically, HealthLinks is part of the Colorado School of Public Health. CDPHE and Kelly have been working with them for a while. And they work with employers around the state to provide certification for their employee wellness programs. And they're providing consultation to lots of people. It's very impressive, the numbers of employers that they're working with already. and educating them about resources and encouraging them to offer different resources for their employees as part of their certification program, which is sort of a plus for the employer to be able to market their company, as well as to ideally contain some of their workers' comp costs and lost work time and that kind of thing. So, those folks that deal with only the 60 and over would be probably less likely to benefit from working with HealthLinks, but there certainly are people who are older than 60 in the workforce, and so it's not totally out of the question. But there is a possibility of encouraging these employers to, this would be the goal for us would be to not only help those employees and employers, but to get reimbursement for what you all are doing. So Lily thinks there's some opportunities for that. And we talked about two things yesterday. One would be to do some presentations along with what HealthLinks is doing, and I'll let Lily talk about that. And then the second thing is to list our classes on their website. And for that, we would need to be clear on there who's eligible to take the class, who could go for free, and whether you want to start charging people who aren't eligible would be another question to consider now or in the near future. So Lily, do you want to, like as I said, fill in the gaps, make any corrections with what I just said, and explain a little bit more about what you hope our partnership would look like?
Absolutely. Thanks, Connie. So as you all, I think I presented now a couple of months ago, no, we're working with a lot of community partners. I don't know if Kelly's still on the phone, but we've been working with Kelly and Becky on trying to really help promote the diabetes prevention program through our network of healthy businesses. And so we have right now 180 businesses that are really actively engaged across 18 different counties in the state. And they're companies that are forward-thinking. We know they have an interest in promoting the health and well-being of their employees, and most of them are investing in it in some sort of way. And so the approach we take is through advising and also through healthy business certification, where these employers receive benchmarking and customized feedback on the resources that could help improve health, as well as really taking a local approach. And so the two opportunities that Connie mentioned, or the few opportunities Connie mentioned, would include us coming up with essentially integrating a portion of the training that we do with employers to highlight what the business case is for them, what the opportunity is for them to provide subsidies or coverage of these programs for their employees. And we could do that by really targeting the groups that would be the target audience for certain courses. One of the things Connie talked about was if we would want to link to specific courses or a list of all the courses, with making sure they have descriptions on who those courses are targeted for. And I think that we have such a variety, we have such a diverse group of industries and the different sizes of employers that we would want to showcase all of the trainings and courses that are offered, and then highlight some through the training that we do for employers, as well as a webinar series, a monthly webinar series that we offer, which talks on specific topics. And so we'd love to have, we talked about having a leader conduct one of those webinars focused on either disability or aging, and those are two topics that actually haven't been really highlighted as part of our existing trainings, and I think it could really add value because we work a lot with workers' compensation and Pinnacle Assurance as a partner, and that's one of the things that they're hearing from their policyholders is a big need, and a lot of it is around education, but I think there could be a lot of opportunity for, as Connie mentioned, employers either stepping up and reimbursing for a course, or also pooling with other employers for almost like a co-op model. So if we're able to match make with employers that might only have like 2 or 3 employees that would be eligible or participating in the course, we would be able to put those groups together and so that they have like purchasing power to be able to purchase or really subsidize these courses.
Okay. That sounds great. And I had a question. I didn't quite catch when you were talking about Pinnacle, and you're saying that you were hearing, or they are hearing that it was a big need. Were you referring to the work with just people with disabilities or aging, or I wasn't sure what the big need that they were hearing about was?
Both disability and aging, and we've heard that among our businesses too.
Oh, okay.
Both full-time and temporary disability, return to work issues, and then aging and accommodations and different impacts that employers are seeing with the aging workforce, and a lot in the rural communities too.
So the disability might be something I could look at, this is Connie, look into with some other sections of the Department of Human Services. While we have always wanted to focus or include the disabled population in our classes, that hasn't been a big focus unless you consider that someone with a chronic condition may also have a disability as a result of that. But that would be something I could check into as well to see if we could have someone that we could offer to you that would focus, like maybe through the Division of Vocational Rehabilitation, on disabled individuals in the workplace, and we could also try to link that to our classes, because while we haven't done a lot of that, so I don't think we may not have as much of an expertise within our chronic disease self-management program folks, that those classes are definitely applicable to people with disabilities. So we could look at a combination perhaps.
Do you do any courses or do any of the courses focus on arthritis?
There is a specific program targeting arthritis. I don't know if anybody, Mary Pat, do you know if anybody in Colorado has leaders who are trained specifically in arthritis?
I'm not familiar with that.
Yeah, I don't hear about that.
Specific to arthritis, other than, you know, it's part of the catch-all of the chronic disease self-management. Certainly we have, you know, participants who are managing arthritis, but that particular curriculum, we haven't had any specific training and or delivery of that, but I don't know if anyone else has.
This is Melissa, but I don't know whether you've had, I mean, I know the arthritis program for the physical activity part, and the LAN program has actually been discontinued. So I don't know if that's what you mean, or you wanted more the chronic disease one.
The what program has been discontinued?
The arthritis exercise program, which they still have it for the water, but they discontinued the land program.
Oh, I was talking about the CDSMP that there's an arthritis specific to arthritis curriculum, but as Mary Pat said, the standard chronic disease self-management program is very broad, but I would think that if that's a specific interest, we could look at whether there'd be a way of getting, you know, a class or how we would do that would be more focused on arthritis. You know, maybe a leader who has a condition, and I'm also trying to look up real quick to see if we can find out if there's some specific training being offered. But is that something, Lily, that
is one of the leading health risks that we, as part of we did a 4-year study with Pinnacle looking at the impact of a health or a worksite wellness program on workers' compensation claims and costs. And arthritis was one of the leading health risk factors that was associated with higher claims and longer disability. And so it's something that the employers are now becoming more aware of, and we're seeing just in terms of one of the largest needs out there. So I think that could be something we could really market to this group.
I'm looking on the Stanford site, and it does have, I don't see any cross-training offered in that in the near future, but they do still have it listed as a special focus, and there's also I didn't know about this, it says there's an online, try to open this, online arthritis self-management workshop, which
about, Connie, is the usage of the online program that you have the scholarships for. If tapping in, I heard Lily mention about hard to reach areas or some of those folks, and you know, utilizing that online opportunity, and that could also include some arthritis programs, perhaps.
Yeah,
but
definitely.
That might be a great matchup with Lily's need by employers and employees to do offer an online version.
Yes, and that is, yes, and Lily, that is something that we have some slots available now that are offered at no charge in Colorado. We've already paid for them. We need to use them up in the next 6 months. And it is the chronic disease self-management program, so it's broad, but people with arthritis who consider themselves, there's a question that, do you consider yourself to be limited in any way because of a physical, emotional, or mental disability? So if they consider to have those limitations, then they would be eligible to take that class. And again, it is online. We contracted for 50 slots, which isn't a lot, but we also haven't used a lot of them yet because I haven't promoted them as much as I should have, I guess. But that would be something that could be offered now, and I can give you information about that. And it's pretty easy to sign up. That go on this link and go through a bunch of questions and that. But if you'd be interested in that, I can provide that information to you.
Great. Yeah, that would be wonderful. And so as the next steps, Connie and I talked about, I've introduced her to 2 people. One is Josh Scott, who's really heading up our training, and that's for both our group of advisors, and these are the lead advisors that meet with businesses and help them come up with their action plans. So they're actually really referring these employers to some of these resources. And so what we would need for that is just some general language that we could include as part of the action plan report. And then also making a connection with our project manager, Michelle Hahn, who puts together our monthly webinar series and is in charge of our whole resource center, which is geocoded so that folks, and it's actually the most highly trafficked page on our website. And so we have people going on and looking up resources, and we're able to actually provide that in the form of web analytics, you know, back to you all so that we can report on how many people have linked to your courses or looked at your web page that have been referred through health links. And so that might be one way we could, moving forward, we could really measure the progress of any sort of partnership that we have as we move forward.
That's great. And is that a live, would that be given live and then recorded as well?
For the webinar, yep.
Yeah.
We give them live and then we put the links up on our site.
Okay. And how long is it, are they?
Usually an hour.
Okay.
Yeah, depending on the presentation, most of the time we try and allow at least the last 15 minutes for Q&A.
Okay. So that sounds great. I had a question about the training, and I want to open it up to other people as well. But when we talked yesterday, Lily, you mentioned having, let's see, how many trainings did you say that you are thinking of over the next year? 12, roughly 12 presentations over the next 12 months, something like that. Are they all over the state, or are they focused in certain geographic areas, or?
They are. Well, one of the groups that we're working with is we were partnered with 4 out of the 5 grantees that received funding from the CCPD grants that were awarded, starting their 3-year grants. And so we're working with Eagle County Public Health, who's working across a 5-county region. So we're doing 6 trainings across those 5 counties, and then we have another training in Delta County, 1 down in Durango, and 3 on the Denver front and on the Front Range.
Okay. So I guess one thing would be for us to talk about on this call or in the future about how we could try to staff those trainings, since that's a lot of, which is a great opportunity, but we don't have one person who goes on the road to do a lot of presentations, but I am sure that we would find people that are very interested in doing that. But so primarily Eagle County and those counties around Eagle County, Delta, Durango, and some Denver Front Range areas right now. So do you all think that, is that something that we could either communicate via email or have a separate call about? And I guess Lily, sorry, I'm asking a couple questions at once, but just to back up, Lily, what's the timeline on, like, when would you be doing these or starting?
That's in Josh's wheelhouse, so I don't know the dates.
Okay.
All of them.
Okay.
Yeah. But we can get you a calendar, and if we could have a point person, I'm not sure if it's you, Connie, who would be the one to coordinate recruiting for those, and it could be a combination. It could be having someone there, maybe for a few of them, but then for other ones, it could be us just presenting some materials, and so that would be a discussion to have with Josh.
Okay, that sounds good. And yeah, I think it would be, I can be the point person at this point, and I think it would be helpful if we, as I mentioned to you yesterday, but for everybody else, I'm thinking it would be helpful we could sort of have a not exactly a canned program, but kind of a topics to cover, and so we'd be getting a consistent message out to each location, but and then we could ask to have people kind of fill in where they're available and interested and can cover. That would probably be ideal. But I'm assuming that's sometime in the near future. So.
Yeah, our first one will be in September, and then this fall they'll be in the Northwest region, so more in Summit, Eagle, Garfield, Pitkin, and you're going to have to remind me where most of your courses are located. Is there a real hub for them?
Well, no. There are areas that we haven't covered at all in the past 3 years, but it's in theory statewide, and where there's opportunities, and we would also try to, even if it's an area that we haven't covered yet, we could definitely talk and see if who might be able to do that. And I know COA works in some of those areas you're just talking about, so that might be an opportunity there.
Yeah, this is Mary Pat from COA, and yeah, we do work with the Eagle County Public Health Department delivering classes in those counties you're mentioning. So it would be a great segue if there was some type of a presentation, as you're mentioning. And so just to kind of summarize in my head, what you're saying is that right now these trainings are really like 1 hour long training opportunities to employees of your partners, who also then that is taped as a webinar and can be disseminated that way. And then that would link them perhaps or introduce them to the concept of the 6-week class that then they are referred to locally in their areas. Is that kind of where that's going?
That would be for the webinar, but there are two different things. One is a monthly webinar, and that's where we would definitely have someone, a leader probably, to present. The other one is a HealthLinks on-site training, and it's either a 2 or 4 hour training, and that's where I really need to defer to Josh, who is in charge of designing the trainings, because we cover a lot of content, and I think you're going to have to talk through what we could fit in, if it would be materials, but what we're trying to do is create opportunities to actually showcase to these employers, or have just some short snippets of different opportunities for their employees that they can take back, so that it's a little bit more tangible than just putting a link in their report or sending out a newsletter to them. And so we've gotten a request to bring more people into those trainings, and that would be on-site.
Okay.
So the webinar would be a one-time webinar that would be focused only on our program for about 45 minutes plus questions, and then there'd be the recording, and then the presentations in person, or the 12-ish ones that HealthLinks is currently thinking of, where Lily is saying it would be great to have a leader who can share experiences, share background about the classes, but also I think those stories about your experience with providing the classes and changes that people make is what really gets people fired up to say, oh, that's exciting, that's what works, and that you've seen differences in people who've taken the classes or workshops. So yes, I will be in touch with Josh about that. And then, yeah, we can work on a kind of a standard presentation with, covering some of the basics, and then, letting people fill in with some of their experiences as well. As far as listing the classes on the website, what do you all think about looking at, as you list your classes, as you send them to COA for the calendar? I think most of them do already say who's eligible. So if it's only for certain, people that are members of a certain health plan or something, that might not be appropriate to list. But where are you all on your ability and interest in charging people or charging a fee for people to participate? Because it seems like this is an opportunity that we could offer a lot more classes if there's a charge, and I think employers and maybe employees would feel like this is worthwhile. And with dwindling grant funds or maybe no additional grant funds, that would limit the number of opportunities we could even offer. So anyway, what do you all think about? Where are you on your ability and interest in charging a fee? Is anybody doing that now?
Connie? Hi,
Yes.
this is Monica.
Yes.
I've had I know that it probably needs to be done at least some fee, even if it's not very much. In our area especially, I really kind of have a hard time doing that just because I know where the people that attend the classes as well as, where people are financially around here. So I'm up for ideas too. A way to do this, or it just doesn't hit them, hard and in the wallet, whatever. And I know we're not talking about a lot of money, but I know the people around here, have a hard time with that.
Yeah. Well, ideally, we'd be listing a charge for the employer to enroll an employee in the program. So, as far as the health links piece. So, because if an employer wants to get somebody in or some employees in a class, I guess I can't speak for them, and Lily can let me, say what her take is on it, but I would guess that it would be more frustrating for them to look on and see that, well, their employee isn't eligible, therefore they can't take one, rather than seeing that their employee could take one at a certain cost and that they would consider paying that cost for that class. What do you think, Lily?
I would agree with having some sort of pricing structure that would be just really transparent for the employer to know how much it would cost, and then if there would be, if there are discounts available depending on coverage or reimbursement models. I'm not sure what's been discussed already with this group, but I definitely think it's something that some employers are willing to pay for.
Yeah. Well, and we're trying to go, obviously we're trying to, as we've talked about before, go towards sustainable models. So this is one. And some of you, I know there are some of the area agencies on aging involved with this, which is where Monica is from. And we have had in one of our meetings here a consultant talking about that there are ways for the area agencies on aging to charge fees if they kind of structure their business a little bit differently. So I think there's that option. Whether people want to do that and is another issue. But I guess I would ask that you all look, consider that, and maybe let me know if that's something that you can do, because that would be, I think we should try to figure that out before, well, as soon as possible. I don't want to delay listing classes, but on the other hand, I don't want to just list classes and then have employers go on there and find out they can't send anybody because we're limited on who we can serve. Does anybody have any thoughts on that right now without taking the rest, it could be a long discussion, but is anybody now charging fees or able to or interested in? Or
Hey, Connie, this is Ellen in Larimer County.
Hey, Ellen.
How are you? Just
Good.
A couple things on our side. Since we're kind of figuring out where we can do this at, and so it is a problem because we are community health. We're not really allowed to charge for it per se. So, we haven't ran into, we do have an employee program that's taking our classes that we get a lot of referrals from, but we haven't charged them because they are part of the bigger umbrella that I'm under. So that's not a problem, but if we were to do another employer or something, it would be difficult for us to charge because we don't have that ability. The only thing we are doing, because the area agency requested that we do ask for donations if to pay forward if they can, to at least pay for the book. So those are just a couple things we're doing, but we're always looking for other options, so let me know.
Okay.
This is Mary Pat from COA, and we only have restrictions based on the funding sources that we utilize, but since we're private nonprofit, we can charge fees, and we do on some of our classes. We have with our employee wellness classes, so that's just some added information. So we sort of are open-ended to charge whatever or make it free.
Okay. Well, that's great, because it may be a great opportunity for you and a great resource to offer health links, and others can, chime in or look at internally whether you can. I mean, some people have already said that they really can't, or it'd be very difficult to do, and that may apply for a lot of you, but maybe not for everybody. And like Clinica Tepeyac, I'm guessing you would be able to charge, but I don't know. Susanna, Maribel, do you know?
No, until now we have not. We are not charging the participants to
well, this would be charging an employer, not the participant.
Oh, so. No, we are not doing that.
Yeah, but
we have not a special class for the employees.
Right.
For now. In
the
future we may have one.
Yeah. Yeah. Okay. All right. Well, let's not prolong that. I think there's opportunities at a minimum through COA, the Consortium for Older Adult Wellness, which is Mary Pat, and maybe some others as well. And then we also have the limited number of online slots that I can let you know about.
Sorry, I apologize. I'm going to have to jump off. This is Lily. So
yeah.
I wanted to thank you all for your time, and we'll be in touch.
Yes, sorry. Thanks so much, Lily. This is really exciting. I appreciate it. I will be in touch with Josh, and then also with other folks about getting the classes available to put on your website. That would be great. And we'll also talk about doing how we do a webinar. So.
Great. Thank you so much. Have a great day, everybody.
Lily, thank you so much.
Thank you.
Spending that morning with us.
Take care.
All right, so we're going to, sounds like a good topic to keep on discussions. I'm guessing we want to maybe have let Connie sort of make contact again with Josh, Scott, and then perhaps a smaller group within the collaborative would want to follow up on that kind of a call, in follow-up. So I'm sure there's some interest there. So our next topic is our name title. Connie, you wanted to have some discussion on that?
Yeah, I'll just touch on it. I did email yesterday afternoon I emailed an email, how about that, to everyone about that. We've talked about it for months, and as we look into how we're going to actually implement a sustainability plan, for example, with health links, we really need to have something we can call it. As part of that statewide effort, and whether we're doing that with health links or Medicaid or another entity. So I just sent out an email summarizing the results of that poll. That we did talk about that on another meeting or another collaborative call, that is, where as a reminder, I gave you the various names and that we had talked about, asked everyone to rank them from 1 to 8. The ones that were most popular were Healthier Living Colorado. So I'm proposing that COA has trademarked Healthier Living Colorado, but that we use Healthier Living as a statewide name. and you can all weigh in on that via email. But from everything that I've considered and all the input I've gotten from all of you, that's the best I can come up with, I think, and I don't mean that as a resigned, like, oh, this is all we can do. I mean that in trying to identify something that would be the most acceptable to the most number of people, I think that is our best shot. But let me know what you think about that and whether your organization could adopt that. Then, someone had mentioned, it might have been Holly or Whitney, but anyway, that physicians and people in the medical profession are used to using terms like chronic disease, which makes sense. And so while we don't, while it's not that appealing to participants to hear those terms and say, yeah, that's me, I have a chronic disease, for medical people, it makes perfect sense. So I provided a kind of a short sentence that could be included in various publications, communications to say, hey, this program called Healthier Living is a Stanford University program to deal with chronic disease, etc. Then the third thing is to have kind of a catchy, what's called a tagline that says to participants, this is what you're going to get out of this program. And I listed the ones that are that I have found that other states are using. We don't have to use one of those because there isn't a national standard for that. But those are the ones I found, and I asked if you all would weigh in on what you like the best, and if you have others to suggest that we could poll people about. And I also give some links to other examples of other states where you could see how they're doing this. So I just wanted to mention that, and it's even again, if we, regardless of whether we get additional grant funding or not, our hope is and plan is to try to sustain this program long term. And it would be sad, I think, to all of us if, after all that we've done, this ended up being just a short-term program that we funded with grant money and then everybody was on their own after that. So that's the reason to still come up with a name that we can use for these statewide purposes of trying to work with health plans or Medicaid or health links or potentially retirement programs to say, here's a great program, your people can benefit from it, and here's how much it will cost you. So I would appreciate getting your feedback by 2 weeks from tomorrow. Does anybody have any questions or comments about that right now? This is a very quiet call.
Yeah. Introducing, once again, a difficult topic.
Well, hopefully by now it's not as difficult. I mean, I know people have wanted to, most people have wanted to have a common name for a while, and
yeah,
the input has been really helpful all along, and I'm not trying to credit myself, but that I did try to incorporate that input into the recommendations. So
yeah.
And with more people coming onto COA's license, for some people it's less of an issue now because they'll, well, I think maybe it's an assumption. I don't know.
Well, then it's in line with the Healthier Living title.
Mm-hmm.
Anyway, so so you're saying 2 weeks from today you'd like to?
Yeah,
okay.
I'd really like to move forward with something and not, just keep going on forever.
Yeah.
So, but that, yeah.
Okay. I think that's fair enough, for sure.
No comments, no other comments or questions, concerns? Okay, thank you.
All right. Okay, well, that really wraps up all of the heavy discussion items. Our next slide is simply showing you when the statewide training are coming up. If I am missing somebody, please holler. I did just quickly do this slide this morning, updated it, and did not look at our website. So there could be something on our self-management website that I have not added. In particular, if there's some fall trainings that anyone is doing, I didn't know, Crystal, you might have something going on, or Glenda, as far as that goes. Is there any other additional trainings that, now Melissa, I know you mentioned one you have coming up, I think a diabetes training. Anybody?
This is I do have some coming up, but the thing I need to clarify is if these classes are going to be open to the public. There are several facilities, but I don't want to put it out there if the facility is not going to be able to accommodate public.
Okay. And this is for leader trainings?
Oh, no, I'm sorry. No, this is for
general public classes.
General public classes.
Yeah, then that's information you can just send to Co, and we'll get on the website for Self-Management Colorado. This in particular would be statewide leader trainings that might be coming up.
Oh, gotcha, gotcha.
So you don't have one, Glenda, in the fall?
No, we don't.
Okay.
Mary Pat, this is Crystal from Secahec. We don't have any on the calendar as of right now. So when that changes, I'll contact. Make sure you get.
Okay, perfect. You just let us know. We'll get it posted.
Perfect. Thank you.
Okay. And I'm not sure if Melissa is still on the call. She mentioned she was going to be in and out. And Melissa, are you on the call?
This is Ellen. I know she is having, I don't know much, but I know that her and Susan will be teaching that or leading that one.
Yeah, she mentioned like in October, maybe diabetes 4-day.
Oh, is that what, I thought it was CSMP and the
yeah, there's something out. Let me.
Oh, well, maybe it's a CDSMP with a diabetes cross training on it or something.
I think
so.
But
well,
I just know Susan's helping her, so I just know that they're doing it, but I don't know the details.
Yeah.
Sorry.
Okay. Well, we'll get that information from her then. Anybody else? And Ellen, you're co-leading this one with Holly, I think.
Correct.
Loveland.
I hope so. Is Holly there? Is Holly going to? I hope so. Yes.
Yeah, she confirmed that the other day. Yeah.
Yes.
Okay. All right. So unless there's anything else on that, we are ready to wrap up our August meeting. Any future agenda suggestions that anyone has they'd like to see us talk about on future meetings? Looks like we have some carryover items that we'll have anyway, and but we always welcome any new ideas that you would like to see the collaborative address.
And I'll chime in and add to that offer to get any input from the Coalition for Older Adult. I'm sorry, I'm looking at COA's name, NCOA. They have so many great resources. They have tons of great webinars that are already available online, but they have also offered before to come onto the call and address, provide their input on a specific topic. So if there's, they're just, as I said, such a wonderful, rich resource of people and knowledge and all that, that, you know, if there are things that you think, I'd really like to know how other states are handling such and such an issue that has been maybe a stumbling block for you, or a goal that you would like to achieve, you know, we can see if they'd be available to talk about that.
That's a great idea.
Yeah.
To pull in, yeah, I think that would be of interest in all of us to hear success stories or best practices even from other states. We get kind of stuck in our own little.
Yeah. Do you have any thoughts about that right now? The types of best practices that you, or best practices about what?
Well, they might be a great resource for doing something on sustainability. as you know,
Yeah.
as far as what they have seen other states be successful in developing.
That's a great idea.
So that seems very timely for us right now.
Yes, that's a great idea. I can ask about that. How much time do you think on this call do you think we could carve out, Mary Pat, for something like that?
Well, I think as our other agenda items, you know, begin to get resolved and move on, then I think, Kate, I would say maybe 30 minutes.
Okay.
30 to 45. And if everyone knew that that topic was coming up, you know, they could make it a priority then, and we could do it and then do our business, wrap around that quickly.
That sounds good.
I would want to give it adequate time because I'm sure there'll be some Q&A.
True. And that's probably not a lot of time anyway, but
yeah, so maybe 45 minutes, maybe with maybe to an hour, and then just know that the rest of the agenda would be quickly covered.
Okay, that sounds good. Should I ask them about the next 2 meetings to see when they could be available?
Yeah.
Would that be okay? Or
I think so. You know, the thing I want to be sure is we figure out Kelly McCracken's.
Oh, right.
The epidemiologist, and
then
have it the opposite meeting.
Sure. That sounds good. I'll check with Kelly.
Okay. And I think she was leaning more towards October rather than September, but I'd say September or maybe November as ideas.
Okay, sounds good.
That's great. Thank you. Anyone else?
That's a great idea.
All right. Well, I know we're going to wrap it up here. Our next meeting is scheduled for Thursday, September 3rd, 9 to 10:30 a.m. That's our first Thursday of the month. And I'm going to just put in another plug here, looking for a collaborative chair. On my notes, I have a little smiley face right by that suggestion. Please be thinking about this, considering that option and a leadership opportunity for yourself. COA is certainly committed to continuing managing the website and all of that behind-the-scenes stuff. But after 3 years, we welcome and encourage other folks to be looking at chairing this monthly meeting. And as we all know, time's going to fly. We're already scheduling September, October, November agenda items, and then we're committed till the end of the year through the December meeting. So want to be sure you guys are all thinking about that. If you are having any interest, you want to let us know, then we'd welcome that conversation. I'm happy to share, and I'm sure Lindsay would too, on kind of what it takes behind the scenes. So with that, I've got my closing slide, which does still show my name as the chair, my contact information, and as always, we invite you to get on the Self Management Colorado site and navigate yourself around. I did get a very nice email from Kelly McCracken this week that said, I know you don't always think people read the minutes, but she does, and she is pleased to see those on there and kind of get what she's missed. So thank you, Kelly. And anyone else, feel free to always tap into the minutes and or an actual copy of this webinar. So with that, unless there's any other comments, we're just under an hour and a half, so great job. Otherwise, I will end it for our August meeting, and I'm going to stop the recording. And thank you very much, all, and have a great rest of your day.
Thanks, Mary Pat.
Thank you.